talk to you about the 5-surface amalgam, or the amalgam onlay, or also known the cuspal covers restoration. So really, it's taking a lot of amalgam and creating a direct crown on the tooth. And we primarily use this, especially in the Canadian forces, for our mandibular or posteriorly endodontically treated tooth. And this tooth here is actually part of what we've started. It's called the Amalgam Olympics, Amalgam Onlay Olympics in Petawawa. Beautiful Petawawa. Not so much in the winter, but in the summer. And what we do is we have all the captains brand new come in, and they complete an endodontic therapy on an extracted tooth, just learning the wave one gold technique, really simplified, predictable, on an anterior tooth, a premolar, and then a molar tooth. And then we practice and post on our WhatsApp group an example of our of their amalgam onlay. So I got them to watch this video, and they've given me some tips. And I really wanted to create this because I remember when I was a young captain, I was very hesitant to do these things because they're painful, unless someone shows you kind of a couple hints. So that's what this video is about, at the start anyways. And we're going to talk about the principles of why we do this. And kind of, this is from an old timer talking about, this is how I talk to my patients about cracked teeth and just having specific restorations. So if this is our tooth, we're looking front to back, and we complete our endodontic access. And what I usually talk about with patients is that we have flexing. And after thousands of cycles of biting, we get on our inclined planes, we get these oblique forces causing flexing of our tooth, which then causes a fracture down the middle of the tooth. So to prevent that in our endodontically treated teeth, because they're subsequently arguably less weaker, but also there's less proprioception, less pain from the patient, because now there's no nerve, no pulp tissue, so now they're more likely to continue to use their tooth in mastication. And I forgot to say that this restoration is a great restoration because it's on endodontically treated teeth. We get cuspal coverage right away to prevent that fracture down the road, and it also gets our patient fit. Now, yeah, it's ugly as heck. I mean, no one wants a silver crown, but I'll tell you, there's a large portion of our military population that actually doesn't matter. They don't matter. They don't care about the aesthetics. They just don't want to have to come back to the dentist. And this is a great restoration to do that. And what I tell our captains here is that using crown preparation, save that time, those time slots for the teeth that really need it, that you can't do this on, such as vital cracked teeth. Reversibly inflamed. You can cut a crown preparation, apply gluma, apply your dentin bonding agent, place your crown down, and salute your crown and bond your crown. See if you get resolution of their symptoms on a vital cracked tooth. And also for aesthetic anterior cases, to do crowns. Don't clog up your schedule. My recommendation is don't clog your schedule doing crowns on molar teeth that are endodontically treated, unless, of course, there's an aesthetic issue. So back to kind of the specifications of this preparation. We need to remove at least 2 millimeters of the occlusal plane. So don't go cheap on the occlusal reduction. Everyone usually does. So make sure you go 2 millimeters. And one of the tips that my buddy Major Mahmood taught me was to round out any of these corners. And what that does is it prevents like a sharp angle, making carving these restorations a lot simpler because it's less likely to fracture off that piece of amalgam. Now let's talk about interproximal reduction. And what we're going to do is we're going to break the contact really simply. And these pictures are from Captain Sulen, and she kind of gives you a great idea. She is an amazing artist here in PET. So we get our 2 millimeter reduction. Make sure you go with the flow of the tooth just to kind of give you a resistance form when you're carving. And then here's breaking that interproximal box, and it's really conservative. You only have to break the contact to get your band down. Don't try to do it without the breaking of the contact, because this piece will actually, if you don't have this for resistance form during carving, you're going to break that off. Just take it from somebody who's tried to do it many times and is very unsuccessful at it. So I just started breaking the box. I'll just use a 330 burr, which is a 0.8 millimeter diameter tip. It's really conservative, and this again, it gets your band down, allows you to get your band between the teeth, and it also gives you the resistance form. So when you're creating, you're carving your amalgam, it doesn't fracture. So without further delay, let's take a look at a clinical example.